We know the importance of the masseter muscle is utilized with elevation and closure of our jaw. Our patients are going to need this particular muscle to help them with chewing, speaking, and communicating. It's a really important muscle for our patients' bodies, and we are actively stretching it during trismus intervention. We are going to start with the external masseter release. Our patients will love this. We can do this in a seated position. We can also do this with our patients lying on the massage table. But our masseter muscle is going to run along our patient's cheek on the right side and on the left side. Whatever I do to the right, I'm going to do to the left. I do prefer to start with my patient's affected side. So there's a couple of things I want you thinking about with your patient's masseter release. I like to go between cupping and letting my hands really hold up my patient's head if they're in a seated position, and then my fingers are doing the external work along that entirety of the muscle, as this is a really great pain trigger release point for our patients. And so we may find this is a helpful stretch or massage technique while our patient is working between rest of active and passive range of motion for their mouth opening. The masseter release can be taught to complete it themselves. So I'm going to teach my patient how to do this. Okay, patient, you're going to bring your hand up. You're going to place your hand on the big muscle, and if you don't know where that muscle is, we're going to have you open and close, feeling that muscle extend and retract. And now we're going to give ourselves circles here along that masseter. If we'd like, we can do both at the same time. There you go. And then completing those circles. So this can be a self-home exercise routine for your patient, and this also can be one that you complete in the clinic for them. Our patient's mouth is open. Now, I'm going to go in, place my pointer finger on the masseter, my thumb on the outside, and I'm going to go working my patient's masseter muscle, finding the pain trigger points all along my patient's masseter. If I feel an area that is a protein deposit buildup, I'm going to work that area. Now I'm going to come out and rest. My pressure is finger is pushing on the inside, thumb is pushing on the outside. Rest. I'm going to give my patient an opportunity to swallow. Sided masseter release. Our patient is going to do this at home. The finger is going to go on the inside of the mouth. The thumb is going to go on the outside of the mouth. Now they're going to work together, moving circles along that masseter muscle. Our patient is able to help finding pain trigger points, holding when needed, moving up and down the length of that muscle. And relax.